I'm Dr. S.S. Honani, surgical gastroenterologist. Today I want to discuss about cancer as a surgeon, what I face when I see the patient and how people are ignoring the cancer part. So cancer, whenever it comes, it doesn't come with a warning. Like it will just come, and patient in early stage, patient doesn't have any symptoms. Most of the time it is very vague. They'll have maybe abdominal pain, weight loss, or generalized weakness. These things will be there. We won't be able to come to know. So any disease which a common disease like weakness or anything, we are not able to categorize and it prolongs more than 1 or 2 months, then we should suspect cancer seriously. So most of the time what the patient think is, okay, if they have abdominal pain, they treat over the counter medication and think that it is a gastritis. They drag it on years together. Most of the time any condition is there, if it is not treated within 2 weeks or 3 weeks, or it is becoming chronic, then that requires a proper evaluation to find out what is the cause for it. So when we do like this, usually many times around 10% of the cases we pick up there is cancer will be the cause of it. Cancer is a very general term. It can come from toenail to head. Anywhere cancer can come. So there are different specialities in the cancer like gynec oncology, head and neck oncology, thoracic oncology and GI oncology, which I am dealing, and uro-oncology, orthopedic oncology. So there are different specialities are there. Like we see, suppose your bike is spoiled, we go to a bike mechanic. We don't go to a lorry mechanic or a car mechanic. Same way otherwise. So whenever we suspect, what I see in the patient is whenever they have problem, they'll meet one person and they expect to answer that person to everything. They expect them to give the treatment. It doesn't happen like that. You have to meet a specific specialist for the particular thing, like that cancer. Thing is that enigmatic question is what to do or how to find out a cancer. So we usually don't try to find the cancer in everyone. The only thing is having a regular health checkup, maybe after 30 years of age, having a very regular health checkup will help us to pick up most of the cancer. Or any untoward changes. Suppose there is a mole in the body, suddenly it changes in the size. Don't ignore, consult a doctor. Suppose you are having, in kids especially, osteosarcoma and all, Ewing sarcoma, this thing happens, they have a pain, bone pain, and parents will neglect, okay, the kid is acting, they doesn't want to study, so they delay it. Suppose if anything, maybe kids may be acting, but don't ignore it. If they are having pain continuously, persistently, it is not going up, consult a doctor. You won't lose anything by doing so. Same way, if anything, any sudden changes in the body which is not improving for a long time, then you should consult that specialist. Suppose if you are having a shoulder pain or a body pain, you meet a orthopedician. You are having any menstrual issue, meet a gynecologist. You have any tummy issue, meet a gastroenterologist. So you have to go to that specific specialty. Don't go to, suppose you are having a menstrual problem, just because you know me as a gastrosurgeon, come and ask me, I will guide. Okay, I will guide, but it is not proper. When you have a specific problem, go to that specialist. He will be able to find out the thing. Now, why I am saying this is very important is, cancer, if it is diagnosed very early stage, irrespective of the place, it can be cured. Now currently we have so many advanced therapies. We have surgery, we have radiotherapy, we have nuclear medicine, we have advanced biologics and chemotherapy. All these things combined together, we can give the cure. Another thing I see in the patient is, whenever patient comes and we advise certain tests. Okay, same thing has happened. I had a very close friend of mine whose father was having upper GI symptoms. I was advising him, get a endoscopy done. Oh, they are ignoring. Okay, now no, we'll get next time, next time. Then after a year, we found that person to be having carcinoma stomach. Then that time he is asking, why you did not force me to do endoscopy earlier. I told them that I have advised, but they are saying that you should have forced. No, it is not like that. As a consultant, we won't force. And most of the thing in India, notion is, whenever doctor suggests a investigation, he is suggesting investigation to make money. No, it is not like that. On 99% of the doctors, when they advise certain investigation, they want to know about what is happening. That is the reason we advise investigations. Yeah, I know that every investigation has certain cost, and that is the thing, like we pay the price for healthy life. That is the thing you have to pay. It is not that the doctor is going to make money. No, that notion has to be removed. I don't know why. Maybe because of too much movies, all those things has created a certain thing in the brain of the patients, that whenever doctor advises some test, they ignore it or they postpone it. No, don't try to do. If any condition is there and it is not improving for maybe at least 1 or 2 months, and the doctor suggests a investigation, please get it done, because you won't regret. And another thing in India I am feeling is, suppose patient get a investigation and investigations become normal, they won't become happy. They say, doctor, I got a full health checkup, I spent around 8,000, 10,000, I don't have anything. No, you should be happy, you don't have anything. The idea of doing health checkup is to find out any problem, not that just because you have spent 8,000 or 10,000 you should have a disease. No, that should not be there. And the another thing with cancer is, like I have seen patients come and we say that cancer is very early stage. What they do is they go back and come back after maybe 1.5 2 months, and they say, sir, now can you operate? Now problem is, the cancer doesn't wait. It every day it grows. Whatever the cancer is there, once we find out, that means it is relatively advanced. Okay, now from that time, every time it multiplies, it doubles, like 2 becomes 4, 4 becomes 8, 8 becomes 16, like that it grows. The patient which has got a cancer, we have seen him earlier stage, which was operable. If that same person comes after 1.5 2 months, it becomes unoperable. So in our practice also, suppose even we have busy schedule, any cancer patient comes, we'll cancel all elective cases and give the treatment to first preference to the cancer, because all elective cases, suppose patient has got a hernia, after a week I'll operate, but whenever the cancer patient comes, we cancel all other elective cases, give first preference, and we operate earliest, or we start the treatment earliest. The reason for it is, cancer doesn't listen to you. It grows means it grows. Another problem is, I have seen, okay, patient is around 50 or 60-year-old and he has got a cancer which is operable stage. A patient says, like, doctor, he is so weak now, if you operate, what will happen? See, any surgery we do, it is like you crossing a road. Can you meet an accident? Yeah, it is a possible you can meet an accident. Are we going to die out of it? Yes, we are going to die out of it. So whenever we do a surgery for a cancer, it will be a reasonably major surgery. It has got always 1 or 2% of mortality associated with the surgery. Now that has to be common sense. Is if we don't operate, there is 100% mortality. So if you operate, this patient has a chance of more than 90% of surviving out of that surgery, and more than 90% of surviving from this cancer. So I never understood what is the logic of asking a patient is weak. Patient is weak because of the disease. Unless we treat the disease, patient doesn't not going to become strong. Many times I wonder why patients are saying this, whether they really want to give the treatment for the patient, to just to not to give the treatment, they are speaking like that. These are the things, dilemmas as a doctor we get, or we wonder. But it is very difficult to say what the patient party is thinking. Maybe it is a ignorance. And another thing is, cancer treatment is not only surgery, not only chemotherapy, not only nuclear medicine. It is a teamwork. Suppose if I have done suppose colon cancer comes, stomach cancer comes, I have done a surgery, I usually always my time I involve a medical oncologist, a radiation oncologist, and we plan the treatment. If cancer stomach is there, we give the chemo, then I operate. Then I call him when we finish the chemo. Neither I am the complete stakeholder of the disease, neither the chemotherapy. Because I do the surgery, I remove the disease. Without chemotherapy, I cannot give a good cure or good survival. Same thing with a rectal cancer. If a patient comes, we have a team and we discuss with the radiation oncologist, a medical oncologist, and we plan the treatment. Then we plan is like a CA rectum, we give CT, RT or chemotherapy, radiotherapy. Then I do the surgery. Then we finish the therapy. Just because you have come to me as a surgeon, I operate and I don't suggest, no, it doesn't happen like that. So, and patients also think that, okay, surgery is done, then nothing has to be done. Okay, recently I had done one retroperitoneal cancer surgery where the large tumor has been removed. After that we planned for radiotherapy. Patient did not come back. He came back after 6 months and our tumor has recurred. So patient need to understand is, before starting of the treatment, you plan the treatment and finances you decide. See, mainly cancer problem is it involves lot of economics, a lot of money is involved. So now I have seen, suppose like we have different kind of hospital. I work from medical college to a tertiary corporate hospital. So whenever my patient comes, we decide that, see, this is the cancer, this is the treatment cost, these are the different hospitals, these are the treatment cost comes, like how much cumulative money you can spend on that disease. Suppose if I do surgery, I spend entire money on the surgery, then you don't have money for the chemotherapy. It is not right, like, because that is, surgery is only 50% of the treatment, or another 50% is the chemotherapy. So when you are planning the surgery, don't go for like brand, or don't do it in a hospital where to show off that you are doing your surgery in this hospital. And this is more important, because some people who have lot of money, it doesn't matter to them, they finish the treatment. So in India actually like 60 to 70% is a middle class, they have a limited amount of money. So what I want to say is, when you plan the treatment for the cancer, you sit with your surgeon, you sit with the oncologist, discuss what is the total cost, and then you come to know where and all you can take to the surgery. Because it is not like that you do go to a corporate hospital and get an entire surgery done and finish all the money, then you don't have any money to the chemotherapy. It is no good, because tumor will recur, and patient we cannot give good cure, or we cannot give good survival. India, no, like medical healthcare is quite cheap when compared to US or any European countries, and medicines are also very cheap, because I have traveled in India. What tablet I take for 500 rupees in here, same thing I had to spend 5,000 in Saudi Arabia. Medicines are cheap, and we have experts in every area. You don't have to go for every big diseases to tier 1 cities. You have tier 2, tier 3 cities. We have experts, we have hospitals. Don't ignore that simple small nursing home, they cannot do the surgery. It is not like that. Okay, now you have to a center, okay, any surgeon, you discuss with them how much cost comes in different places, because once the complete treatment is done, then only we can offer a proper cure. Now another part I find is, for cancers, especially liver cancers or any cancers, patient to go for alternative care. They'll see somewhere somebody saying they went that fellow that gives some medicine, after that if you take 10 days 15 days it get cured. No, it is not like that. Cancer doesn't have cure. There are certain cancers which has a miracle. When you give certain times, body itself fight against it, there is a cure. Okay, now but most of the time these Ayurvedic medicines or other alternative medicine, what they do is they take those things hoping that it will cure, but what was operable becomes inoperable, and most of them they die in a very bad situation. So my message to you guys is, whenever you have a disease which is chronic, means which doesn't improve for months together, 2-3 months, then you consult a specialist. Don't neglect cancer, because cancer diagnosed, treated earlier gives cure. Cancer neglected, feared, will end up in very bad quality of life, early death, and also it will cause financial ruin.